Hello everyone, my name is Kaylin Flemons and I'm a psychiatrist. I choose to study this so I can help those who are mentally ill. The setting of my practice is very calm and a supportive environment. We strive to help those who want help. I come here today to share that the certain disorder has had an increase in my patients. Statistics has shown that over 200 patients of mine have shown signs and have been tested positive for autism. While there are many different symptoms of autism, the main signs include difficulty with communication, difficulty with social interactions, obsessive interest, and repetitive behaviors. While there are a few treatments for patients who have autism, here are the treatments that we use: anger management, family therapy, applied behavioral analysis, behavioral therapy, and animal-assisted therapy, and telepractice. We also use other methods for autism patients, which include cognitive and behavioral therapy for anxiety and applied behavior analysis for aggressive, disruptive, and self-injurious behaviors. For medication, we use atypical antipsychotic medicine such as risperidone for aggression. The average duration of these treatments would depend on the patient's development. In severe cases of autism, I would have them stay on the medication and continue to go through therapy as long as possible. The nature of these treatments are there for the patients to adjust to their surroundings. I pulled a case of a patient that I'm currently treating. I will not mention his name for obvious reasons. The patient is a 13-year-old African American young man who's diagnosed with a mildly high case of autism. His family's socioeconomic status is middle class, so they are able to afford the medication and treatment for his autism. The previous medical conditions include anger issues/aggression and high social anxiety. I recommend that he takes risperidone for his aggression. Then I recommend that he goes to anger management therapy and that he goes to behavioral therapy for social anxiety. I recommend that more health professionals are able to diagnose and educate themselves with autism because autism goes unnoticed in cases daily. I think there should be more education out to the general public so that people are more familiar with autism and the symptoms of the disorder. One issue that needs to be addressed is how little educators and general public know so little about this disorder.